The purpose of your transplant evaluation at Baylor is to find out if you need a new liver and if a transplant is right for you. Plan on several busy days of appointments for lab work, x-rays, consultations, and educational classes. You must bring a caregiver, such as a friend or family member, to help keep track of appointments and other important details.
I felt it was very organized. There is a next step and you kind of get ushered through the process. And for me, that put me at ease.
You must keep every appointment and arrive on time. If you don't live nearby, you will need to have a place to stay overnight near the hospital, like at a hotel, with family or friends, or at Twice Blessed House. We'll talk more about that a little later. During evaluation, you meet with your transplant care team. Your pre-transplant coordinator is a nurse and your main contact during the evaluation, and also while you wait for your liver transplant. She will explain the tests and consultations, your responsibilities, the waiting list, and what happens while you wait for a liver transplant. The pre-transplant coordinator is your go-to person for questions or concerns during the evaluation. Other key members of the transplant care team include the hepatologist, a doctor who specializes in liver disease. The hepatologist will help your primary care doctor manage your liver disease while you wait for a transplant. The hepatologist will do a thorough medical exam and help decide if you could be a candidate for a liver transplant. One of the transplant surgeons or nurse practitioners will talk with you about if surgery is right for you and answer questions about the operation. We have a large team of transplant surgeons on our medical staff, and one of them will perform the transplant surgery and manage your care right after the transplant. The role of the Baylor social worker is to find out about the support you will have from family and friends, your employer, and other community resources. Part of your meeting with the social worker will include an interview with your support person. The social worker will also assist you with financial concerns and discuss resources available to you. Some transplant candidates may see one of the Baylor nutrition specialists to help you meet your nutritional needs before and after surgery. They will review your nutrition status, including your weight and muscle mass, typical food choices, and eating habits. You will attend a class where several transplant team members provide information about the transplant process. We've already mentioned the transplant coordinators. They are your personal contacts throughout the transplant process. The pre-transplant coordinator will be available to help you before the surgery. The post-transplant coordinator will help you after surgery. Our transplant financial staff will review the money aspects of liver transplant, including your share of the medical expenses, out-of-pocket costs, the long-term financial obligations, insurance requirements, and financial resources. A post-transplant coordinator will explain what to expect on the day of surgery, the transplant operation, and recovery after surgery. This is the nurse who will likely call you when a matching organ is found. A lot of dedicated and skilled people make up your transplant team, but the most important members of your care team are you, your support person, and your primary care physician. This is especially true while you're waiting for your transplant.